Now you'll get to meet Dr. Smiley as she performs chiropractic adjustments as part of our virtual tour here. Dr. Smiley, what are you doing today?
I am checking Grace's spine. I am looking for any misalignments that can be causing any interference from her brain to the rest of her body. So how this works, this very intelligent brain of hers will send messages down the spinal cord, out the nerves to every organ, tissue, and cell. My job is to find where there's any interference. So let's check Miss Grace out. We use an instrument. We use hands. We also have a drop table, so it depends on what the individual needs, on what we decide to do for them. So there's all different ways to adjust. Some require more aggressive adjusting, some not so much. I'm proud to say that my youngest patient's been an hour old and my oldest has been 100. On your back, please, Grace. Hold this leg up, hold it strong. Good, relax. Hold this leg up, hold it strong. Hold it strong. All right, slide down to me some. Perfect. So this is that drop table that we talked about. Bend the knee for me. It's gonna drop underneath. See if she's where she's supposed to be now. Hold it straight, hold it strong. Fantastic. Toe in, toe out. Are you aware of a difference there?
Oh yeah.
All right, we're gonna check these ribs. She's balanced, which is great. I'm gonna have you go ahead and sit up. Turn and face me. We also do neuromuscular reflex testing. So basically I'm just checking different reflexes on Miss Grace to see if we have any imbalance in the organs. So liver, gallbladder, stomach, pancreas, spleen, small intestine. And so when I hit a reflex where there's an imbalance, this arm just goes weak. Breathe in and out. So we're gonna turn that circuit back on. Hold it strong. Breathe deep. Relax. Perfect. And I always try to pull on the fingers because that does help stimulate nerve flow. That will help the arms and the neck. They don't have to pop, but we just want to gently pull. And Miss Grace, you're a better version of you as we speak.
Thank you.
Have a great day.